Welcome to this lecture on climate change and the health of vulnerable worker populations. My name is Grant Torrey, and this lecture entails a brief overview of how occupational health is being impacted by large-scale changes to the global environment and what can be done to protect our most vulnerable workers. Here are the learning objectives for this lecture. Please take a moment to review them. In this section, we will define climate change and talk about its ongoing impact on the health and well-being of vulnerable populations. We will then discuss how climate change poses unique threats to occupational health and safety. According to the National Aeronautics and Space Administration, or NASA, climate change is defined as long-term changes in the average weather patterns that have come to define Earth's local, regional, and global climates. And it is important to remember that climate change is an ongoing process, with a complex set of both human and natural causes. However, since the Industrial Revolution, anthropogenic causes of those originating from human activity have led to significant emissions of carbon dioxide and other greenhouse gases, driving changes to our global environment. Natural processes such as volcanic eruptions can also serve as contributing factors, but on their own do not explain the rate of climatic changes that have been observed in Earth's recent history. Scientists use a number of key indicators as evidence of climate change, including increases in land and ocean temperature, sea level rise, ice loss at the Earth's poles and in glaciers, and the frequency and severity of extreme weather events such as hurricanes, heat waves, wildfires, droughts, and floods. Beyond changes to the environment itself, there are various pathways through which climate change is both directly and indirectly linked to human health. Direct mechanisms through which climate change adversely affects human health include extreme weather events, problems with water, food, and air quality, changes in the transmission of select infectious diseases, and threats to mental health and well-being. However, the impacts of climate change span many sectors, through which human health is indirectly influenced. Some of these impacts include changes to the productivity of agricultural and food systems, disruptions to the built environment and transportation networks, disturbances to natural ecosystems and resources, and heightened demand for energy production. Like many determinants of health, the adverse impacts of climate change disproportionately burden vulnerable populations. Some of the populations most at risk of climate-related health impacts include pregnant women and children, older adults, individuals living with chronic medical conditions or disabilities, communities of color, low-income populations, and other socially disadvantaged groups. Recalling that work itself is a social determinant of health, there are many occupational groups that are particularly at risk of climate-related health disparities. Although overall groups that are vulnerable to climate change are not the same, it is important to recognize that individuals may fall into multiple categories of vulnerability. In considering vulnerable worker populations, the United States Environmental Protection Agency provides the following examples of workers with overlapping vulnerabilities to climate change. For example, outdoor workers who live and work in the same communities may encounter climate hazards such as air pollution or wildfire smoke more frequently or for longer periods of time. Older adults, especially those with chronic health conditions who are still in the workforce, may be more sensitive to extreme heat compared to their younger and otherwise healthier counterparts. And finally, workers from immigrant, low-income, or other under-resourced communities may have limited capacity to prepare for or cope with climate-related hazards, such as hurricanes, even when the exposure is expected. Recognizing that workers are more vulnerable to the impacts of climate change, we will now discuss some of the factors that contribute to this increased vulnerability and subsequent health disparities. Mainly, workers often face greater exposure to climate-related health risks, including extreme temperature and weather, poor air quality, disease-carrying pests, wildfire smoke, and more. And thus, the United States Environmental Protection Agency has defined key threats to occupational health in relation to climate change. They include heat-related illnesses, respiratory illnesses, physical and mental health effects, vector-borne diseases, and pesticide-related effects. For example, workers are increasingly exposed to extreme heat and heat waves. The risk of heat-related illnesses is high for both outdoor workers, such as those in agricultural, construction, and transportation industries, and for indoor workers who work in manufacturing plants and warehouses. Heat-related illnesses are also of particular concern for those workers with physically demanding job responsibilities, especially when they have inadequate access to rest, drinking water, and air conditioning. In terms of physical and mental health effects, frontline workers and first responders are increasingly engaged in disaster support for extreme weather events such as flooding, storms, and wildfires. Responding to these extreme weather events thus puts workers at greater risk for injuries, illnesses, and even death. Frontline workers also experience the burden of mental health effects, which can include anxiety, depression, and post-traumatic stress disorder. Finally, in terms of pesticide-related effects, changes in agricultural productivity and the distribution of pest populations has led to increased use of agrochemicals, including pesticides. Agricultural workers in nearby communities thus face increased exposure to pesticides, and without proper prevention, workers' families and household members can be exposed to pesticide residues through the take-home pathway.